This is Dr. Sultan Moinuddin Shaukat Ali. Greetings from Ikramed, and I'm your faculty here on abdominal ultrasound. When it comes to examination of abdominal ultrasound, today we are going to discuss a very important finding as such, not a pathology. So many of them mistake it as we have found out a pathology on ultrasound. No, today we are going to discuss about splenomegaly, which is in itself not a pathology, but it's a abdominal finding. So splenomegaly itself is not the diagnosis. It is one of the finding which can lead you to diagnosis. I have discussed about approach to various splenomegaly in my previous session. So in my clinical approach to splenomegaly and clinical approach to how a spleen patient should be sought and what are the differential that should be given when a patient comes from pediatrics, or patient has hematemesis, or patient has got liver cirrhosis, patient is alcoholic. So depending upon all of this scenario, patient has got fever, viral illnesses, long standing portal hypertension, young patient, old patient, patient suspected of lymphoma. So all these things are to be taken care of, patients of tuberculosis. So all these things should be sought and thought of when you are giving the report on splenomegaly. Okay, and wherever necessary, you can also mention that kindly rule out this, kindly rule out this, so that would help out in further probing out the patient's way, and this is how you'll stand out differently to the to the clinician, that you are also helping and your opinions do matter when it comes to treating patients. Okay, so be a clinical sonographer and not just tailor sonography or a massage sonography. Okay. Okay, so with this, let's start with today's short lecture on splenomegaly. So when it comes to splenomegaly, there are multiple causes. You can go and read it from books, but to enumerate the major ones which are very essential and you should always remember are which I have enumerated here. So hematological illnesses like thalassemia we have seen because of extramedullary hematopoiesis, all hemolytic diseases, see, hereditary spherocytosis, hereditary elapsocytosis. Then in cases of sickle cell, initially you have got splenomegaly. So all these are very important. All hematological diseases are they are very important causes of splenomegaly. Then hemodynamic causes like we discussed CPVC, spleen. In case of right heart failure where IVC is dilated, you might see pedal edema and Gamnag antibodies are seen. Then infectious causes, malaria, typhoid, Kala Azar, the storage diseases, Gauchers, etc., etc. Metabolic and infiltrative diseases. Okay, so also in cases of infiltrative lymphoma, neoplastic illness like METS, traumatic, you can have not exactly splenomegaly, but you can have a splenic laceration or perisplenic hematoma, which may give a false impression of an enlarged spleen because of perisplenic collection. Connective tissue disorders like SLE, in case of RA also you can get rheumatoid arthritis, you can get splenomegaly. So the spleen is one such organ which is enlarged in lot many conditions, but in this we are going to discuss what is the upper limit of adult spleen. So upper limit of adult spleen is 12.5 or 12 centimeters on to remember. Now sometimes if for tall males it can go up to 14 centimeter, but on an average in Indian population 12 to 12.5. So 12.5 is, you can take it that as the cutoff. Okay, now next important thing, if you have patients who belong to pediatric age group or who belongs to age group which are lesser ones, so what about those? So in all those cases you have got a special formula, and I'll be discussing that formula too so that it becomes very clear for you all. Okay, so in all those patients which are less than 12 years of age, that is in case of pediatric age group, you have got a special formula for spleen. Formula for spleen. Okay, so what is the formula for spleen which you are supposed to remember? So remember the formula: age in years divided by 3 plus 6. This is the formula, and this is the maximum limit above which you call it a splenomegaly. For example, let us take examples so that it becomes very clear for you. So number one, suppose if there is a child whose age is say 12 years, then what is the cutoff for splenomegaly? 12 upon 3 plus 6. So what is 12 divided by 3? Answer is 4 plus 6, that is 10 centimeters. So you know that after 12 the pediatric age group is gone. So in pediatric age group the maximum cutoff you have is 10 centimeters. Above 10 centimeters you call it as splenomegaly. Remember, this formula cannot be used above 12 years of age. Now suppose if there is a child who is say 9 years of age. So in this patient, suppose if I want to tell whether a liver which is 8 centimeter enlarged or not, sorry, spleen measuring 8 centimeters is enlarged or not. So the way to calculate is easy. You have to use this formula which we have discussed. So let us use the formula 9 divided by 3 plus 6. So that is 3 plus 6, that equates to 9. So the cutoff is 9 centimeters. So that means that in this patient liver can be there, sorry, spleen can be there till 9 centimeters. That means 8 centimeter is not an enlarged spleen. Okay. So this is a very important formula to tell you the cutoff for splenomegaly in a pediatric population. Now let us look at how the normal spleen looks and how splenomegaly appears on ultrasound. So here look very carefully. This is how a normal spleen appears. You know that it lies below the left dome of diaphragm, and this is the anterior border which is notched, and you are able to see the splenic hilum. Now very important, compare it with this, compare the spleen with this image. So now look here, this is the spleen here which is not normal. You are able to see that we have measured from upper pole to the lower pole. So this is the upper pole of the spleen, okay, and this is the lower pole of the spleen, and if you measure it from upper pole to lower pole you get the measurement more than 13 centimeters. That means this is enlarged. And moreover, you also take the thickness of spleen. So the thickness cutoff is 4 centimeters in adult. If it is more than 4 centimeter thick, like in this case, you can see the thickness is huge. On measurement it was more than 6 centimeters. So that means this is a thick liver, and that means that this is a case of splenomegaly. Okay, this is splenomegaly. Okay, fine. So this is how you diagnose splenomegaly. Now let me show you one more image. Now here in this image you are able to see this is spleen which I am highlighting now. This is the anterior border, and these are the splenic vessels in the hilum. Now look here, this image shows pathological spleen, where you are able to see that I am not able to cover even the entire spleen in one image of ultrasound. Then the spleen is too much enlarged. Okay, it was like this. And if you take, I took the measurement, it was around 13 centimeter. The thickness was also increased, and here the thickness was more than 6 centimeters, which is definitely increased. But you look at the next thing you look at is the echogenicity. Now look here, the echogenicity is more than that of liver, again more than that of liver, but you see that there are no area of hypoechogenicity or no area of infarct, no calcification as such. It is a diffuse splenomegaly. Okay, so hope that this part becomes very clear, how splenomegaly appears and what are the various cutoffs which we use when it comes to splenomegaly. Now, the next important thing which I am going to discuss is a special type of spleen which is called wandering spleen. This is defined as a mobile spleen which is attached only by an elongated vascular pedicle, allowing it to migrate to any part of the abdomen or pelvis. So sometimes the normal spleen might be present like this, and there might be attached to a vascular pedicle and another spleen which might be mobile, which can keep on moving only by elongated vascular pedicle, and it can migrate to any part of abdomen or pelvis. And so this is a result of congenital anomalous development, and there might be malformation of the normal splenic suspensory ligament. There are also other findings of characteristic, which is there may also be finding of characteristic comma shaped spleen in extra abdominal position. Doppler USG is very important because it demonstrates the vascular flow in the spleen, and it helps to differentiate whether it's actually a wandering spleen or a splenic torsion or infarct. Okay, so now look here, in this case you can see here that this is spleen, and a wall of concentric vessel is seen in the region of hilum, and you can note that there is a spleen of ectopic position. Okay, so with vascular pedicle, so this is sometimes there in case of spleen. Okay, now another important variant is clefts of spleen. The notches and clefts of spleen are another congenital shaped anomalies which are located on the diaphragmatic surfaces, and especially very important, the superior border, as I've always talked about, shows notching, and these are nothing but remnants of grooves. So basically when the spleen develops, they are in the form of multiple separate lobules. Now I ask you, which is the other organ which develops this way? Yes, fetal kidneys develop this way. And these lobules later on unite together to form such a structure like that, and that forms a spleen. So the superior border shows still notching which are due to those fetal grooves or fetal lobulations. Okay, now I'll show you the image so that things become very clear to you. So here this is a normal spleen, and see, can you see that superior margin? You can see some amount of notching here in the anterior and superior margin. You see notching, and here look, here in this case we are able to see this liver, and there is a big cleft here. So these clefts are normally seen. There is a well-defined thin hyperechoic line which is passing through the spleen, which is called splenic cleft, and these are remnants of uh, embryonic remnants. So this was all about spleen. So in this session we have talked about spleen, the appearance, the splenomegaly, and two important type of embryonic variants. One was splenic cleft, and the second important thing which we have discussed was the wandering spleen. Now we have also discussed about splenenculi in my previous session. So this three four are important. This three things. Number one is the wandering spleen. Number two is this splenic clefts. Number three is splenenculi. These three are very important anatomical variants. Sometimes there can be asplenia, that is absence of spleen. Asplenia denotes there is absence of spleen. There is another important pathology which is different from the anatomy. I want you to know that thing also. Wait a minute. So I'll discuss that too with the help of an illustration so that you will remember. So that's an interesting case. Once a case came to me, and she had an abdominal lump. Okay, and basically the case came to me on CT. So she had a lump, a weird lump over here in the abdomen. Okay, and the spleen was missing. The spleen was not there on CT. So I decided, let's call the patient and let's do an ultrasound. So we called the patient, we asked her, we exposed her for doing the ultrasound. So as I opened up the abdomen for ultrasound, of course, so we saw that there was a big laparotomy incision in her abdomen. So I asked her, there's a big laparotomy incision here. I asked her what surgery was did she already undergo. So she told me that she underwent a laparotomy surgery for a trauma which was years back, and she doesn't remember what exactly happened. So but I understood the condition that the laparotomy was done after trauma, so they must have found out that the spleen was shattered and they must have removed of this spleen, so the splenectomy was done. But remember, when spleen gets shattered, some spleen tissue can dislodge in the peritoneum, and this might develop later on into small spleens inside the peritoneum, and this is known as peritoneal splenosis. So this is a very important combination, that when you see an abnormal weird masses in abdomen which are enhancing like spleen, and the spleen is missing, old history of laparotomy with splenectomy, so we gave the diagnosis of peritoneal splenosis. Okay, so this is how you need to think about clinically when patients come to you, so that the diagnosis gets established. Hope you have enjoyed the talk. Next, I'm going to speak on various pathologies, but before that, I need your feedbacks and I also need your comments. Whatever doubts you have are most welcome. Thank you. But whatever doubts you get those after you see all of these videos. Okay, so that few of the things I have continued them in some other videos. So those doubts get cleared off when you see all of these videos nicely. Okay, hope have a great day. Thank you.